So when they walk into my room, you can almost see the fear in their eyes. And if you explain to the patient that, look, you have a 90 to 95% chance that your pain will be completely relieved, most of them are quite relaxed. The hip pain is usually in the groin. When the groin pain gets to such an extent that you can't control it with other methods, for example, taking your Panadol or taking your Nurofen doesn't control it. If you avoid the activities that cause the pain, for example, you can walk up to 300 or 400 meters and the pain starts to get very severe. That is a good measure of a quality of life. Then these are the people who should consider a hip replacement. And surgery has a good way of controlling the pain in a significant proportion of people who have the hip replacement. I expect that patients who have a hip replacement would by about 6 to 8 weeks be able to take their dog for a walk. And by 3 months, most of them will be able to get back on the golf course. The consensus in orthopedics is that people continue to recover up to a year. And so after a year, most people actually forget that they've had a hip replacement because the pain is gone. I would say to the patient, go to your local doctor and ask your local doctor whether you are a candidate for hip replacement. Your local doctor would probably do an x-ray and see whether or not you are a candidate, because your doctor will determine whether you have all the criteria for a hip replacement, and then your doctor will refer you to an orthopedic surgeon.
Care to Share, brought to you by Buderim Private Hospital, because your health matters.